Dental malocclusion is essentially when there's an incorrect positioning of the teeth in each jaw. It can also include incorrect positioning of the jaws, or it can be a combination of the two. So sometimes you have straight teeth with jaws in the wrong position, and sometimes you have jaws in the right position and teeth in the wrong position. So it's a combination of the two usually, but it can be one or the other in isolation. Well, some of them, sometimes parents will notice when their children first grow their teeth that they're not looking exactly right. And at this point, a lot of parents will come to ask me, why is this happening? What's going on? At the consultation, normally we will diagnose, usually if the parents see something's not right at the age of 6 or 7, normally it's a sign of things to come for the next 5 years. Normally if there's a little bit of crowding, you will see this in other teeth later on. So the main thing at the consultation is to get a diagnosis and find out what's going on. Some conditions are developmental and we can treat early, and it can minimize the kind of severity of the condition later on. Some conditions we need to wait till growth is fully complete. And so it very much depends on what the problem is, what's causing it, and we can, following the consultation, give advice as to whether it's something we can fix or whether it's something to wait to fix later. Essentially, a lot of parents will notice either the children are sliding their jaw forwards when they're eating, or they're sliding to the side, or that the teeth are in the wrong position. They're crooked or they're twisted, that kind of thing. So usually it's either functional or it's aesthetic. Dental malocclusion is usually caused by a combination of environmental factors and genetic factors. So all of us inherit from our parents, and not always they're desirable things, but things that also cause malocclusions are things like dummy sucking for a long time, or thumb sucking beyond the age of 6 when the adult teeth come in. That can really, really affect the way the adult teeth grow. And habits, some people have habits, and these habits can also affect the teeth. But I would say it's always generally a combination of environmental factors as well as genetics. Surgery is normally reserved for patients that have more of a jaw deformity. If it's more the tooth position, that can be treated very easily with braces, and the teeth can be repositioned into the correct position, and it can take away functional problems and improve your bite as well as give you an amazing smile. Surgery is more reserved for patients where the jaws are in the wrong position, and this can be the lower jaw being forward, the upper jaw being forward, back, that kind of thing, or if there's an asymmetry where the jaws are to the side, but also for vertical problems where perhaps people have very, very long faces and their teeth don't meet at the front and they don't have a bite, or where people have very short faces where the teeth kind of brush up with each other excessively and cause soreness in the top of the palate. So surgery is usually reserved for patients that have more of a genetic component, I would say, where they've inherited a jaw pattern which isn't the healthiest. And that's normally performed when the patient's finished growing, because usually with growth, the jaws change, and we want to make sure that growth has stabilized, the jaws are not changing anymore, and then we can correct the jaws surgically and also treat the teeth with orthodontics.